All right, good evening. This is exam review for exam one. I'm going to share my screen. I have sent out a link to the Quizlet so that you can utilize that to review for exam one. I sent that in your course room email. So this information is located in Quizlet, and you can actually study using the different methods here: flashcards, learn, test, or match. So I have created 3 Quizlets that have the information here. So we're gonna for review tonight, we're just going to review the information in the flashcard format. So the greatest impact on a child's overall health is the financial stability of the family. Children from low-income families have an increased risk of disease and injury. Therefore, the greatest impact of a child's overall health is the financial stability of the family. So that's really important to remember, because if the families are not able to provide the health insurance or pay for those co-pays and things and such like that for children when they have those injuries or those childhood illnesses, then it can negatively impact the child. Housing may not be available for migrant workers. Therefore, the spaces that they live in are many times crowded and is of poor quality. So poor quality and crowded places of residence can contribute to health problems such as tuberculosis, gastroenteritis, hepatitis, and exposure to high lead levels. And it's just directly related to the poor quality of it might not have running water. There might be so many people in the place that the normal hand washing and hygiene cannot take place. So housing may not be available for migrant workers. And as a result of that, it can negatively impact the migrant workers' health. Therefore, they have the potential for experiencing or actually getting infected with tuberculosis, having gastroenteritis, hepatitis, or be exposed to high lead levels. Because sometimes the quarters, the housing might not be in an area that is new. So we do know that the older homes might have lead paint might have been used to paint those homes with. Caregivers of chronically ill clients are at risk for mental illness related to caregiver burnout and stress, and are at risk of neglect and abuse of their family members when that happens. The nurse should teach caregivers stress reduction techniques. The caregivers many times they actually get sicker, or experiences different disease processes directly related to stress, because they're the one that is caring for that chronically ill client. They're the one that's called on to take them to the doctor's office to go get medications prescribed that have been prescribed, to pick those medications up. Meanwhile, they're also having to maintain their own lives, going to work and taking care of things at the home. So caregivers, should expect to teach them stress reduction techniques. So you are the school nurse and you are talking with the parent or either the coach about a child or a set of children that have asthma. So in an intervention that you should consider to discuss is pre-treatment with a short-acting beta agonist before scheduled physical activity or activity to prevent the asthma attack. So you're being proactive. So you as a school nurse should expect to include as one of your interventions for a child that has exercise-induced asthma. You should expect to do pre-treatment with that short-acting inhaler before physical education or an activity, before if they're playing, soccer, if they're a cheerleader, any activity that might cause that asthma attack. You should expect to administer or teach the coaches about administering that short-acting inhaler. Avoiding pet dander, mold, smoking, and dust is essential when we're talking about people that have asthma, particularly children. So even stuffed toys are not desirable because they said they collect that dust and also dander. So the nurse should include the following reminder in the teaching about dust. Dust collectors such as carpets, upholstery, or drapes should not be in the bedroom of a child that has asthma. So you want to avoid pet dander, mold, smoking, and dust. That is essential to preventing those asthma attacks. So you should include that dust collectors such as carpets, upholsteries, or drapes should not be in the bedroom of a child that has asthma. All right. Let's switch to another Quizlet. And again, as I just stated, you can, the Quizlet, the link that I sent out, you can review the information using any of these formats. To prevent obesity, the nurse should encourage a diet that follows the food pyramid, avoiding sugary snacks, including 100% fruit juice, which has empty calories. So to prevent obesity, the nurse should include a diet that follows the food pyramid, avoiding sugary snacks that include those 100% fruit juices, because those have those empty calories. So you, as the community health nurse, is putting on a health fair or some type of community event. So you are trying to be proactive and think about what can prevent low attendance and participation. So you want to make sure that whatever the health promotion topic that you're reviewing, that they are actually interested in it. Make sure that they have some interest in whatever you are promoting. Because if not, you will have low attendance and participation. The community nurse should assess the client for the risk of violence in their current relationship. So how are you going to do this? What is your conversation going to include? If you're trying to assess the client for the risk of violence in their current relationship, you want to ask the client to describe the relationship and indicate to the nurse how the client feels about the relationship and their partner. So you want to ask those open-ended questions so that the client will tell you about how they feel about their partner. How will you as a community nurse try to improve attendance at a health fair or community event? So you're putting on a health fair or some type of a community event, and you want to make sure that your attendance is great. You want to educate the community on the importance of the health promotion. So not only you want to make sure that the topic is of interest, but sometimes just providing that information to them to say, hey, why this information is important. Because they might just not know that the information is important. Therefore, you want to include that in your discussion or your conversation or whatever it is, the way that you're putting the information out about the health fair or the community event that you're getting ready to have. You want to include how important the information is and how relevant it is to that person. Because if they deem it important, then the likelihood of them participating is greater. Okay, so you're getting ready to create a survey. What topics should be included on that survey? You want to determine if the community is concerned or serious about that health problem and how they feel about that issue in general, and then the preferred time or date of the event. So if it's at the wrong time, your turnout is going to be low. And if they're not really concerned about that topic, then your turnout is going to be low as well. So regular checkups are recommended at least every 2 years to assess the growth and development of a child. So every 2 years at a minimum. Immunization boosters are recommended between 4 and 6 years of age, and again at 11 and 12 years old. Physical activity is important. Therefore, children should be physically active for at least 30 to 60 minutes per day. It is essential. Physical activity is important. For children, they should be active at least 30 to 60 minutes per day. When designing a pamphlet informing the workers of ways to minimize pesticide exposure, what level of prevention is that an example of? If you're designing a pamphlet and you're informing the workers of ways to minimize pesticide exposure, which level of prevention is that an example of? Primary. You're providing that education about something. There is not a disease process currently in place, and you're not detecting or screening for anything. You're just providing that information. So that is primary prevention. A school nurse is meeting some of the parents for the first time. What should the goal of the nurse be? Establishing a productive and culturally sensitive rapport that supports effective communication and collaboration. You want to establish that rapport. And in order to establish that, you need to understand, those cultural sensitivities. You need to, you may have to research that out. You may have to have conversations prior to meeting, but you should establish a productive and culturally sensitive rapport that supports effective communication and collaboration. Which level of prevention is this? Screening for hepatitis or educating on the signs and symptoms of tuberculosis to report is an example of which level of prevention? Secondary. Remember, we're screening or detecting for secondary prevention. So we're screening for hepatitis or educating on the signs and symptoms of tuberculosis. So this is secondary. Now, if you were just talking about tuberculosis just in general, just telling us about it, then that would be primary, but you're actually educating on the signs and symptoms. Remember, you are screening or trying to detect if a disease process is actually there. So this is secondary. Which level of prevention? A non-pharmacologic management of back pain. So the treatment is, or the intervention does not include medication. It's non-pharmacologic, and the issue is back pain. Is an example of which level of prevention? Tertiary, because you already have a disease process or injury that is there. So even though that the intervention does not include medication, there is back pain. So we're trying to manage that. So that level of prevention is tertiary. Remember, the primary preventions, the focus is on preventing problems before they actually occur. Okay, let's switch. Let's look over here at another Quizlet. Washing hands often, for example, before eating, before, during, and after handling or preparing food, before dressing a wound, before giving or taking medications, inserting contact lenses, after contact with body fluids or blood, after changing a diaper, after using the bathroom, after handling animals or their toys can lead to washing hands during or before these things, the examples there can lead to a decrease in infections. We know hand washing is the single most thing that we can do to prevent the spread of infections, washing those hands. The child expressed interest in administering their own injections. What should you suggest the child do to prepare for the self-injections? You are the school nurse, or you're the the nurse at the local community center, the nurse at the church. But anyways, you have a child that expresses interest in administering their own injections. What should you suggest the child do so that they can be prepared for those self-administrations of those injections? You want to suggest that they practice the injections on a doll until they feel comfortable. One of the Healthy People 2030 goals is to reduce firearm-related deaths. The priority when evaluating a client's home for safety is that they have the firearm, find out where the firearm actually is stored. So a goal for Healthy People 2030 is to reduce firearm-related deaths. So what is that priority? What should take over priority when you are having that conversation with the parents and you're evaluating the client's home for safety in regards to a firearm? You want to find out where they're storing that firearm at. Is it easy accessible? Treatment of the child with infantile eczema is aimed at relieving the pruritus or the itching, hydrating, lubricating the skin, relieving inflammation, and preventing infection. Therefore, the nurse should teach the following. So you're looking at, our focus is treatment of a child that has eczema. You want to bathe the child with mild, non-perfumed soap. Okay, let me share my screen again. So examples of social determinants of health include living in a low-income housing development. Remember, there are several examples of social determinants, but be sure to understand living in a low-income housing development is an example of social determinant of health. The nurses working at a local homeless shelter, they know that it is important. So you want to consider your population. So the people that you will most likely be working with are homeless. It is a homeless shelter. So know that it is important to create a trusting environment because it is essential to the development of therapeutic relationships. And you want to establish that rapport. So whatever it is, your next steps, your interventions, so that the person will actually take part in the intervention. So you want to establish a trusting environment, a therapeutic relationship, because otherwise your interventions or whatever you have for the client to do, they're not going to follow through with it because they don't trust you. Untreated iron deficiency anemias progress slowly, and in severe cases, the heart muscle becomes too weak to function. If this happens, the nurse would expect to see what signs and symptoms. So we have a person that has untreated iron deficiency anemia, and the heart is that muscle, and it can become too, if it depends on how it's affected, the heart will not pump like it's supposed to. It's weak, the function of it is weak. So if it's not pumping that blood out like it's supposed to, what signs or symptoms should you expect to see in the client? Shortness of breath or edema, dyspnea or either extremity edema, because that heart is not keeping up with moving that fluid around. The parent asks the school nurse what should be done for their child that has ADHD when completing their homework. So the parent is asking you, the school nurse, what suggestion do you have? So you should expect to tell the parent, give the child breaks between periods of work and study. That therefore their focus can be brought back in alignment if you give those breaks between doing one thing and the other. The nurse knows that the primary source of lead is paint from old deteriorating buildings. Therefore, you should suggest avoiding older buildings due to the deteriorating paint. The school nurse knows in order to manage the following symptoms: itching, burning, erythema, and purulent drainage of the eye, you as a school nurse should expect to apply a warm compress, not ice packs, in order to treat it. So let me just demonstrate for you an example of how to use this information. So we went through the flashcards. If we click match, okay, so children from low-income families have an increased risk of diseases and injury. So we're trying to match the question with the intervention or the correct answer. Okay, let's go to this one. In children with exercise-induced asthma, the school nurse should expect to include the following intervention: pre-treatment with a short-acting beta agonist before scheduled physical education or activity to prevent the asthma attack. So you're trying to be proactive. So you should expect in their care plan to include the administration of that short-acting, because remember, their asthma is exercise-induced. So we do remember with migrant workers, many times housing is an issue. Housing may not even be available. So they may have to, the workers might have to live with others. And so the conditions are crowded. And as a result of that, regular hygiene can take place. Therefore, they are at risk for tuberculosis, gastroenteritis, hepatitis, and exposure to high levels of lead. So caregivers of chronically ill clients, we want to keep the caregivers healthy because they're the ones taking care of the chronically ill. But you should teach them, the caregiver, teach them stress reducing techniques so they're able to cope. So the greatest impact on a child's overall health is the financial stability of the family. So children from low-income families have increased risk of disease and injuries. Therefore, the greatest impact of a child's overall health is financial stability of the family. So the family is unable to provide shelter, food, if they don't have the insurance where they can go to the doctor's appointments, and or if they don't have insurance, they're not able to pay for those visits to the doctor, then that will negatively affect, all those things will negatively affect the child's overall health. And remember, with asthma, you want to avoid those triggers. And triggers are things like dander, mold, smoking, and dust. So we don't think of it sometimes, but dust collectors are carpets, upholsteries, and drapes, and those things should not be in the room of a child that has asthma. All right, let's see here. Let's go to learn. Let's get personalization. Let's see. To prevent obesity, the nurse should encourage a diet that follows. Let's see what this is.
To prevent obesity, the nurse should encourage a diet that follows
the food pyramid. You want to avoid the sugary snacks that and including 100% fruit juice, because those are empty calories.
Low attendance and participation might occur because of
They may not be interested in the health promotion, and the participants just might not, the community members just might not be interested in what what you have set, your topic for that day. The community nurse.
The community nurse should assess the client for the risk of violence in their current relationship by.
You want to ask the client to describe their current relationship. How do they feel about their partner? How
would you, as a community nurses, try to improve attendance at a health fair or community event?
So you want to ensure that the community really understands the health topic and the importance of it. Because if they don't know, what it's about, and also how important it is to become aware of it and become knowledgeable of it, then they might not, more than likely, they're not going to participate. Your participation is going to be low.
Topics that need to be included in a survey.
Again, you want to determine if the community is concerned or serious about the related health problem, how they feel about the issue in general, and the preferred day and time. Because if you're having things when most of the community members are away for work, then how are they going to actually participate in the community event? And again, we just mentioned if they don't deem that it's serious, the health topic is serious, then more than likely they're not going to participate.
Regular checkups are recommended.
Regular checkups for children are recommended at least every 2 years to assess the growth and development. At a minimum, most people don't wait that long, but at a minimum, because they should meet those milestones by doing that time frame.
Immunization boosters are recommended.
Between 4 and 6 years of age, and again at 11 and 12 years old. Okay. Let's look at this other Quizlet. Let's see, did we do this one? Let's do test mode on this one. Okay. Untreated, let's read it.
Untreated iron deficiency anemias progress slowly, and in severe cases, the heart muscle becomes too weak to function. If this happens, the nurse would expect to see what signs or symptoms.
Remember, we said edema. They should expect to see that edema. Because remember that heart is not pumping that fluid like it should be, and then we should expect to see shortness of breath. This mode right here, don't do the test mode because it's only true or false. So the answers are not there for all of them. So I wouldn't suggest doing the test mode, but I'll talk you through these questions. So for a child that has eczema, remember we want to avoid those triggers. So we want to bathe that child with mild, non-perfumed soap. Because we know those soaps that have that perfume in, those are those things that agitate that condition. So we do know that the school nurse knows in order to manage the following symptoms, itching, burning, erythema, and purulent drainage of the eye, they should apply that warm compress. Do not apply a cold compress.
The nurse is working at a local homeless shelter. They know that it is important to
create that trusting environment because it's essential to the development of the therapeutic relationships. The conversation is not going to go anywhere because if they don't trust you, whoever the individual is don't trust you, how forthcoming would you think that information is going to be? They're not going to give you much information. So you want to establish that trust. Washing hands often, for example, these are just some examples of when you should wash your hands. But we know washing hands is the single most thing that we can do to prevent the spread of infections. So before eating, before, during, and after handling, preparing food, before dressing a wound, giving or taking medication, inserting contact lenses, after contact with blood and body fluids, after changing a diaper, after using a restroom, after handling animals or their toys. You know, we want all these things. You just can never wash your hands enough. That all those things decrease infection. So this is why I'm saying don't use the test mode, because it says select from the list, click a definition to match it with the term, but we don't have any terms over here. So do not do the test mode. And I'm just reviewing the information. Okay, I have shared this link. I sent it to the email in the course room for the Quizlets. Okay, I will share this link once it is uploaded to the YouTube so you can review. Happy learning.